Dealing with transition for your ACPs, whether that's transition through training or whether that's when they are transitioning from trainee into the role of an advanced clinical practitioner, can be challenging. There's very few ACPs out of all of our ACPs that are trained that I haven't seen problems around this. I think initially trainee ACPs, they see who's around them from an ACP perspective. So if you take cardiac surgery, for example, at our trust, I think there's about 15 ACPs in that team, but they've been around for over 10 years. Some of them are working at very, very, very senior level, and they've been qualified for 10 years plus. Then you've got new trainee ACPs coming in who are looking at those individuals thinking, I need to be at that level, but at the end of this master's program. So the first thing is making them realize they really don't need to be at that point at the end of the master's program. You would never think about putting a F1, a foundation year one doctor, on the same rota as a consultant. Well, that's the difference in 10 years of training or being qualified. So you have to have those structures in place initially. I find that helps relieve some of that anxiety. It's about letting them know where they'll sit within rotas and how it will differ from their colleagues. I think it's important though that they realise that it is a challenge and it is difficult and it's not easy. And just because you're an expert in what you did before and you had expertise, you're starting to train in a new role, and you have to be, and I say this to them, you have to be comfortable. I was a band 7 charge nurse in the emergency department before I became an ACP, and I was very much seen as one of the most clinically sound nurses in the department. I came on my course and I realised I knew very little, or what I did know was very good for emergency medicine, but what I didn't know was all of the underpinning knowledge and how that would transfer to other body systems and things.
Some of our trainees have described situations whereby they are a level 3 prescriber, and because they're stepping into a trainee space, they've gone back to being a novice. And that can be quite challenging because I think they feel, well, I know I can do this. And the conversations that we have is remembering that scope of practice has changed because you're now occupying a trainee space. So I think for me, it's about sort of saying it out loud and allowing people to talk about the feelings that they have of moving from being in an expert sort of position to then coming back to be a trainee and be a novice.
It can be a lonely environment to work in, primary care, and it can be hard to transition into that advanced practice space. However, valuable, good quality supervision really aids that process.
Certainly for me, it was a bit of a shock coming into advanced practice. Even though I'd done supervision and had thought I'd prepared for it, nothing really quite prepared me for that. So for newly qualified advanced practitioners or people who are just starting in that role, it's really key to support them through that transition and help them to recognise what the differences are in their role and what the expectations are going into that role.
My closest colleagues in advanced practice currently are all nurses by registration and have come into advanced practice, have gone from a mindset of actually it often being told not to make independent clinical decisions, and then into a role where they have to make independent clinical decisions, including being first on call, making decisions whether to admit or discharge from ED. We need to be very sympathetic and empathic to that change, which doesn't happen overnight.
Initially, we do put more emphasis on is the supervision around the clinical pillar in the first probably 1 to 2 years. And that's particularly because often that's where the biggest amount of uncertainty comes with our advanced clinical practitioner workforce, as they feel more uncertain around the clinical decision making. That's often sometimes where their biggest knowledge gap will be. And that's where the majority of our supervision will come. And the majority of that supervision is done by consultants or senior clinical ACPs who have the expertise around that. And it also ensures that the credibility is there as well. We realised early that there's definitely some difficulties when our ACPs transition from a trainee to a qualified ACP, or what I'm saying is when they start to join rotas all the time. So they're all supernumerary prior to this, and then we moved into 3 months of supervisory. So they would follow a rota, they would join back onto a rota, they would be doing nights or unsocial hours if required, but they would be alongside their ACP supervisor. So we have 2 models. We have the buddy, we call them the buddy. So we have a buddy and we have the supervisor as well, which can be a consultant or senior ACP, but they would be mapping their shifts against that individual, working within numbers. but not having the pressure of that they have to see patients, they have to do this, they have to be meeting these outcomes over 3 months, which helps them transition back into working on social hours and those different feelings around it.
What you can do as a supervisor is really get that person to focus on just working through bite-sized pieces of competence or areas that they need to look at or focus on, because you can really just become overwhelmed sometimes when you're moving into this role. So ensuring that that person stays focused, really giving them very clear development points of what they're doing well, what areas that they need to focus at, identifying gaps in knowledge and skill, and then coming up with a development plan, ensuring that the whole team is also supporting them as well, giving that person clear feedback, because quite often you're working as a role and you're getting no feedback on your performance and you're thinking, am I doing a good job? Am I not doing a good job? What are other people thinking about me? And really understanding that as a practitioner is really, really important.